A microbiologist who completed a stint in managed isolation believes there's a number of weak spots in MIQ. It's been confirmed a Northland woman caught the more infectious South African strain of COVID from another returnee while they were both in managed isolation at Auckland's Pullman hotel. But health officials don't know exactly how it was transmitted between the pair. Dr. Duncan McMillan spent his 14 days in isolation in the Novotel at Auckland Airport in November, and he joins me now. Dr. McMillan, were you surprised to hear that there had been a COVID transmission in managed isolation?
No, not at all, actually. I kind of expected it was a matter of time, really.
So what makes you say that?
Well, one of the things that makes me say that is because after immediately exiting the plane, I noticed that the social distancing really wasn't happening. It was getting more and more crowded as you got to the bus. There wasn't a 1.5 metre distance, and that's what you need when you have a mask. You have to have both parameters. You can't just have one. The mask is not going to help you from a close distance. And then I noticed that my room wasn't very clean at all. I had some facial hair around the bathroom, and there was a used milk carton in the fridge, and that's when I started to have a look a lot more closely at what was going on. It really wasn't my intention to go in there and do an audit, but I felt compelled to do it after seeing these fairly obvious problems, really.
So what were some of your biggest concerns? You've mentioned a couple of things there, but nurses, were they wearing proper PPE when they did tests?
Oh yeah, the nurses were doing their best. They were wearing proper PPE, but they weren't given N95 masks while I was there. And I think that if you're going to be close to people that potentially have COVID, then you're going to need to have an N95 mask on to protect both you and the people you're testing afterwards as well.
What about mixing of guests?
Well, actually, that was the reason. The real thing that really compelled me to write a letter to the minister about it, and it was because I had just done my day 11 test, and the very next day, a new busload of people arrives. Now, these people are checked in, and they're kept separate from guests as they're checking in, and that's good, right? But immediately after that, they can then come downstairs and mix with the general population, in which case then you are mixing two populations at various stages of quarantine. And that, for me, represents a big problem because throughout the stay there, I didn't see frequent washing of the lift buttons, and that's the immediate contact point between different people.
Because presumably the argument would be that they're supposed to stay 2 metres from you and wear their masks, even if they are in the same general area as you.
Yeah, that's a general argument, but the thing is that everybody's going to push a lift button at some point in time, and that is the contact point right there.
And
that's what you've really got to nail.
What were your observations around cleaning?
Well, as I said at the start of this interview, my room wasn't very clean, so I suspect the deep cleaning of the rooms probably doesn't happen quite to the degree that it should be. It should be more or less hospital clean if you're going to be stopping a virus like this one that's so catchy.
One of the suggestions that's been floated and is being investigated is whether people should have to stay in their rooms, like for the final 3 days or after they get their last test, not to stop any risk of mingling. Do you think that's a good idea?
To be perfectly honest, from personal point of view, I'd be more inclined to do it over the first 3 days because that's when you're potentially most infectious. Hopefully, the procedures in MIQ are such that we are controlling it to a degree that you will not get spread later on. However, since the incubation time on average is 4 to 5 days, if you actually isolated people over the first maybe 5 days or so, then did your testing right about then, the chances of them actually having it after that should be significantly reduced. So from my point of view, and as an opinion, I would say the first days are probably more important than the last.
Right, because they've just introduced basically a new regime where you get tested on day 0 or day 1, call it what you will. You have to stay in your room until you get that result back, but that seems to be you get it within 24 or 48 hours. So you're suggesting maybe up to 5 days could be the solution. Stay in your room before you get past the worst possible infection period.
Yeah, 4 to 5 days. I mean, look, I've been through MIQ. I know that it's not an easy thing to do for anybody. And I know that, spending 4 days in your room or so is not going to be the most pleasant experience in the world. But I do wonder if this is the best way to prevent spread. And you've got a couple of tests in that period, your day 0 and your day 3. Theoretically, you're going to catch it by then, with any luck.
So you were so concerned by some of the things that you saw there that you wrote a letter to the COVID response minister, Chris Hipkins.
Yes, I did, yeah.
What's he said to you about the problems and issues that you've laid out?
So far, nothing. I haven't heard anything back. So I wrote to Chris Hipkins, and I wrote to the MIQ team about 2 weeks ago now, and it was after 1 week later that George Block contacted me, and then I said, well, you know what, I think I've actually got to tell some people about this, because of these virulent strains, you're not going to be able to stop them so easily, so therefore you really need to have some kind of oversight going on, microbiological oversight going on, and I didn't see that happening. Doesn't mean it's not happening, but I didn't actually see it happening, and I saw these little gaps in procedure, and I thought to myself, well, we've really got to do something about this if we want to stop it.
So no official response to your correspondence?
No, not as yet, no.
And, well, Dr. Bloomfield has told us today that he's pretty confident in the system. He says it can never be 100%, but he has confidence in the system. Do you share that confidence?
Well, from what I saw in November, no. I don't know what they're doing and what changes. They said they've implemented some changes since I went through, so maybe these new changes could be actually more outlined and more transparent to people.
Appreciate your time this evening. That's Dr. Duncan McMillan, who's a microbiologist, and he did his 14 days in isolation at the Novotel, Auckland Airport hotel, and that was in November. As he said, he wrote to the minister, hasn't heard anything back yet.